This week on Rescue Vet, an emergency foster family welcomes a new dog into their hearts.
That's the look of love right there.
Yeah.
Only to face an unexpected challenge as a dangerous growth puts her future in jeopardy. As I make the difficult decision to amputate her toe to save her life.
It's a really tricky procedure.
I'm Dr. Scott, and this is Rescue Vet. Older animals have always held a special place in my heart, and it's especially tough for senior dogs who find their way into rescue.
It's okay, good girl.
Fortunately, there are incredible people like Jean and her daughter who open their homes and hearts to geriatric pets.
We just love having her in with us, didn't we?
Today, they're bringing in their foster dog, 13-year-old Chopper, to see me. She has a concerning growth between her toes, and as with any fast-growing mass, it's crucial we take a closer look.
Okay, you guys want to come in? Hello, Chopper.
You want her on the table?
Yes, please. I'm glad you're saying him and her, because Chopper, it's just...
Anyone who uses it in my grammar as well. It's simple about cats, but we have two boy cats, and now we've been switching it all. I had a boy dogs before, the baby.
Yes.
And then gosh, Chopper's Matthew Lucius came.
No, and nor is it the most feminine name, but hey, who cares? If that's the one you know.
I'm not afraid, Matt.
Are you? It's really hard to look at her face when that thing is looking at me constantly. It is even worse. Well, this is serious.
The last few days, it's definitely
Gotten worse.
gotten worse.
Hey, baby.
She's licking it all the time.
Oh,
But she runs around on it.
She doesn't seem to. She jumps off the couch, on the bed.
right. Okay.
Look at that. I know, it's awful, isn't it?
Absolutely massive. Yeah.
Yeah.
So I'm going to use the technical term squishy.
Mm-hmm.
So it's a fleshy mass rather than a hard, bony mass or anything else. But it's all centered around this one toe.
You think the toe will have to go, or?
You guess it, Jay. It is all centered around this one toe here. Yeah, so that's P4. If I was to take that toe off, then I think I can get behind it here and then remove it from either side and then be able to cause it together.
Okay.
But it is sizable and horrible. I would be surprised if it doesn't give us some level of discomfort, because it's kind of like, well, it's like having a stone in between your toes in a shoe, It would just be, every time there'd be a bit of pressure, wouldn't it?
She is always she is.
Just tell me a little bit about her story. So you're a fosterer.
Yes.
Is this the first foster you've ever done?
It is.
She was previously owned by someone.
She was previously owned by someone, and one evening I saw on Facebook they were looking for an emergency foster because she had been brought to the vet, who I guess contacted Protected Paws. She got a suitable match, so she brought Chopper over the next day, and it's been nearly 3 months. And I think, we had a dog for nearly 16 years, and I was looking, maybe for an older dog, somebody, just because I know it's like sort of older dogs and how to deal. Our dog was quite ill towards the end, so I'm sort of capable of looking after
Senior citizens.
He's added so much to our life, I have to say, and
Amazing.
my mother is nearly 85, can't walk dogs anymore, but on the days that I go to work, she comes to the house and she kind of manages the house and the pets, and I think it's, she said it's brought her a sense of purpose again, and and it's also kind of filled a void after our Charlie is gone, so hopefully this will be a sort of long-term.
Yeah, well, Chopper sounds like she's a very lucky girl falling on her feet with you guys. Sounds absolutely nice. She's got a mum and a grandmother and a sister. Tremendous.
She's very spoiled, she is. She sleeps in bed with us. Yeah, she's very sad.
Emergency foster. That's not something that you hear very often.
Her owner just was no longer able to look after her, brought her to the vet as far as I know. And I think it perhaps was hoping to be able to put her to sleep at that point.
And do you think probably because of the foot? So I assume the foot is there.
The foot is already, the foot is, she was already there. And perhaps, I don't know enough about the back history, but the vet then, I guess, got into contact with Protected Paws, and and they started looking for a foster because they wanted to, investigate what was going on. I think she probably still has, a few good years left in her. And I think just like humans, dogs, animals deserve a good end of life.
Yeah.
A comfortable end of life.
So, because it's rare that at that 11th hour, a dog of her age gets a reprieve, but clearly the vet felt that this was a dog that definitely had more life in the old girl yet.
Yeah. And I feel quite lucky that I think there are a lot of, requests to take her on as well. So it wasn't just myself. I think there are a lot of good people out there who do want to, take on dogs. So I feel you're really lucky, aren't you, Anna?
Today is going to be a bit of a tricky day because this surgery isn't easy. You'll imagine that there's a lot of blood vessels there, there's a lot of nerves around there. And unfortunately, yes, I think we are going to have to amputate that toe to be able to get the result we're looking for. But that said, we don't need it to be an athlete.
Yep.
We just need it to be comfortable.
Yeah.
And I think that that's the best way to try and remove the mass. Because as much as I know that there was some tests done previously, we don't know for sure if those tests are 100%. So we will be sending off the mass to get histopathology. So from the lab, the pathologist look at it and it will tell us if there's anything to worry about. But obviously I'm going to try and remove it completely. So even if it is a benign growth, it won't grow back.
Okay.
That's the plan.
Good. She's in your hands, and
Well, yeah, she's a
I
lovely.
think they were really lucky to find you.
Oh, well,
So
thank you. Well, yeah, I'm happy to do what I can for rescue. So, she's lovely. She's baby. So, I now need you to relinquish your newfound love, and I'm going to be taking Ed to meet Jason, my registered veterinary nurse,
Okay.
and together we will be doing a quick X-ray of that foot just to see that the tissue hasn't invaded into the bone.
Okay.
And as long as it hasn't, then I can move forward with actually amputating the toe. Sorry, Sobe. And then removing the rest of the tissue and closing it up.
Bye, Chobham. You're good. So we'll see you in a few hours. Okay, good as new.
See you later, guys. Say bye. Bye, foster mom. Bye. Hey, Jason. So this beautiful girl, this is Chopper. And she's a lovely, lovely girl. She's on foster with her family. You can see, look at this foot. Oh dear. So really swollen. This growth is taking over this toe on both sides and also underneath. You can see there. So unfortunately, I think we do need to amputate this toe. What we'll do is just take an X-ray over now, and then we can amputate the toe in surgery, and I'll just remove the rest of the tissue. Okay, well, let's get an IV in first thing. Yeah, good girl. Well done.
It's heartbreaking to think that Chopper's previous owners wanted to euthanize her when she still has so much life to live. As a vet, there's nothing more rewarding than knowing I can perform a surgery that will truly improve her quality of life. After today, this painful growth will no longer cause Chopper suffering. The X-ray will give us a clear picture of how far the mass has spread, help determine if it could be cancerous, and allow me to assess how much of her toe will need to be removed.
X-ray. And that looks good. So you just see that the bone is fully intact. So that's basically where the toe is with the mass on either side. But you can actually see the bone is perfectly fine. What I'll have to do is take the toe off from this joint here. So right there. And then I can remove the rest of the mass. Let's get her up to surgery then, shall we? Let's go. So I'm just about to perform this toe amputation on Chopper, which is a real shame when you're 13 years old to lose your toe, but it really is the only way for me to be able to take all of that nasty looking ulcerative, very fast growing tumor away. Thankfully on the X-ray, there was no evidence of any tumor to the bone itself, no cancer, which tends to look a little bit like a moth-eaten sort of coral-like presentation, but that's not the case here. So I should be able to remove the toe and all the tissue around it, and hopefully, if I'm successful, the tumor won't go back, which would be great for Chopper. And it does look to me like maybe this will be an amazing foster fail and Chopper will get a wonderful new home with Jean and her daughter.
It's going to be a tricky but vital surgery today.
Right, who do we think are ready? Okay. So the difficulty here is making sure I've got enough tissue to be able to close what's going to be a massive deficit in this dog's foot. So that's the tricky bit. This is called electrocautery. It's just a way that we use electricity basically to cauterize blood vessels, because there's a lot of blood vessels around here. It's a really tricky procedure. I'm just trying to preserve the blood vessels on one toe whilst ligating on the other and removing this very squishy tumor, which is going to get in the way and not allow me to remove it. So most of that nasty tumor will seemed around it. Sending that off to the lab, finding out what exactly is going on. Now the toe's off, it's all about closing up, and I now can check to see if all the tumour's out, but also have I left enough skin to be able to close the wound, which thankfully I think I. So after a couple of hours in surgery, I have just finished. Hopefully, this should heal quite nicely, and I've done my very best to remove all of that nasty tumour. So let's see what pathologists say, but fingers crossed, this is the last time she'll have to have any surgery on this foot. That's great. Let's put a dressing on. Look. So it looks much better. But, yeah. So pretty happy with that result, actually. It's a really tricky surgery to do. Lots of blood vessels, lots of nerves, but managed it. And yes, one less toe, but hopefully no more tumour. Ready? Oh, good girl. Brave girl. Well done. All right. Good girl. Zion. Oh, sweetheart. Good girl. Made it through. One less toe, but also one less tumour. Yeah? Right. Come on in. Let's go. Let's go. Good girl. Let's go. Let's go. Good girl. Good girl. Here we go, baby. Alright, well done. Good girl. Well done. Alright. Go. Here we go, Angel. There you go. You're such a good girl. You did so well, you poor old thing. Hey? Good girl. Alright. Good girl. Mwah. Good girl, yes. Let's call Jean. Good girl. You stay. Good girl.
Hello. Chopper. Oh, you've got a collar sleeve. Oh, gosh. I took it.
Okay, there you go. So you think.
Does she have to? Yeah, because she has a mattress. Oh gosh, look at that. Oh, you did such a good job. You did so good. Oh, you did. I don't think she can reach that though, Leo. Oh, look.
You've got her. Okay.
She did good.
So what we've done today, taken off at this point here.
Okay.
So the tumour was going all the way around here and all the way around here and then under here as well. So actually by taking it off here and then liberating from this side and this side, this big fat toe has come away, and then I've just been able to clear the edges of the tumour, and then I've been able to close it together, which is a bit more tricky actually. I'm very happy with the surgical result. A little bit of bleeding that's gone on, of course, but yeah, she's woken up full of beans. Now it's aftercare, so I'm changing the dressing every few days.
Okay.
Then the sutures, because of her stress levels and how tricky the closure was, I would suggest she gets a light sedation for that to be completed 10 to 14 days post-operatively. So that will be not next week, the week after. I'd love to see her. Get her. I'll get that right eventually. I think we need to work on the name as well as the foot.
I have to change it, but then we didn't know how long. We didn't know what was being involved. It's spontaneous, and we didn't know if we were keeping. And I thought, come on, she's 13.
Yeah, we can't change the name.
So we're thinking like Chuck, like
Cherry.
Actually, know they're like
Cherry could be nice.
because we had a Charlie. You could just change it to something that's
similar
similar.
sounds, right?
I'd say so,
Cherry,
but like, what rhymes with chopper?
nothing.
Nothing nice. No.
Oh, I agree with that.
No. Okay, well, look, you guys can work on that the next 10 days. In the meantime, healing should go, I'm hoping, without a hitch. And so I'm really happy with the result now. So,
Okay.
so that's Chopper just gone home. And what lovely people. Just so, so lovely. And to be able to help that little girl and to see her walking well, tail wagging as well after losing a toe. So tough and resilient is Chopper. So maybe we'll work on a different name. But in the meantime, she's a very happy girl and she's safely going home with her lovely foster family, hopefully forever family as well.
It's been 10 days since Chopper's surgery,
Hello, you see how your Dr. Scott.
and today Jean, along with her mother Barbara, are back for her checkup.
Yes, come on through. Come on through. Hi, baby. Come on then. You're not ready to go out just yet. Come on. Come on now, Barbara. Here you come. Bring a seat. I love that you two are matching today, Barbara. That is nice. Look at that.
Girl, I guess you could, little girl.
That's it.
I don't want to block you.
Right, so how's she been doing?
I think great. I mean, she's really, she's just been going out in the backyard in the front. I sometimes take her a little bit out just in the front, but not walks yet. I feel like we do need to get that back because I worry that she'll be too comfortable.
Yeah.
Right, in the house. She's going to become, I think,
Yes, getting back to normal lifestyle. Dogs go for walks.
Yeah.
That's part of the job description. Look, it's healed really well. It's extraordinary when you look at a foot. You go, actually, I can't really see that she's missing a toe. It's weird, isn't it? But like I don't think anyone's going to pick out on your fact that that's missed a toe.
Not at all. Where they used to always look at the yellow by that time.
Yes.
So she's walking out at 5.
Got the sedation
Okay.
ready, so I was going to just give that first, and then we can just talk through the lab results. All right.
It's a bit more relaxed.
Yes,
Where are you giving it to her?
So just in her bum. All right. So nice. If you give her a nice sort of deep scratch that she's thinking about something else. That's it. Well done. Oh, brilliant. Good girl. There we go, baby. Good girl. Sleep time. It's all good. It's all good. She's looking a little bit sleazy.
More relaxed.
Yes.
Is she trying to play that?
Well, she's relaxed. She's not shaking here. Her legs, I feel like they want to get out, but she doesn't want them to yet. She's fighting it. She's a tough girl, this Chopper.
She is.
She's a tough one.
And actually, you know what? I feel like gone are the days where a name has a gender associated. So I actually quite like Chopper for her.
You know,
It's kind of funny.
used to it.
Have you worn Dodger as well?
Initially we fought.
I love it.
But to be honest, now we love it, and we have all sorts of little nicknames.
No, yeah.
Chopstick, lamb chop. I mean, you can do
Yeah. Little chump of Horace.
Yeah, so it's fine. Used to it now, and I think at her age,
She's rocked it for all this time. She can keep it for a little longer. Yeah. Oh, baby.
I know she's nice and relaxed now.
She is.
Yeah.
She is.
It's the first time I've seen her one.
Yeah, I know.
Let's have a look.
Yeah, you can tell.
So yeah, I mean, it has healed really, really well. On the side as well. Looks great. Yeah, and that, you know, I'd do go like that, and then if you quickly went that way, you go, oh, yeah, sure.
It's only if you compare.
Yeah.
While it's great to see her recovering and healing well after surgery, I now have the difficult task of sharing the biopsy results with Jean.
The pathology is showing that it is sarcoma, so it's a type of tumour, and it is a malignant type of tumour. It has a low mitotic index, which means that the cells aren't as active, and therefore they're less likely to spread.
Okay.
That said, because of where it was, and even though I had to take the toe away in order to remove all of the tumour, the cells have still gone into the margins. And normally when we talk about margins, it's only about 2 to 3 centimetres. And if you think of her foot, that would be taking a whole foot off, which obviously was not what if we're going to do. And certainly not at her age. He said it's not appropriate. So what I've done is done my very best to take as much of the tumour away as possible. But at the microscopic level, a few cells have gone a bit further than I could take. So that is disappointing, and it does mean that we could expect to see return of the tumour. That is possible. No, it's likely to be a same location, yes. Particularly if the low mitotic index means it's unlikely to metastasize out to the rest of the body, but locally it could be possible. So we just need to wait and see. Yeah. It's really healed great, you know. I'm really happy with that outcome, and you know, it's
I know she's walking and she seems
walking and comfortable.
because it was really big. Like,
It was huge by the end, wasn't it? What does Chopper mean to your family now?
He's ours.
Yeah, he's a part of our. We can't imagine. We've only had him now for a couple of months. Feels like a lot.
I've always had him.
Yeah. So
And it's good for me.
yeah.
And I won't, now, Jean works Thursday and Friday, so I'll be over there Wednesday night. Thursday and Friday.
Yep, and she'll stay with Chopper for sit down, keep her company, keep each other company.
Yes. Yes. Two ladies with experience together. enjoy your time.
Aches and pains.
Don't say that to me.
It's a lovely girl, though.
Waking up, I can see. You want us to wake up, aren't you?
So I can't go anywhere.
Are you woken up?
Do you? Good job. You're almost awake.
Oh, honey.
Your stitches are out. You don't even know what's happened. Your nails have been cut. It's like being at the salon. Oh. Good girl, aren't you? She always looks at you like, sort of looks into your soul. Oh, Sean.
That's the look of love right there.
Yeah.
She's a good one. Yes, you are.
Oh, you're a good baby now. You're awake.
All right. Okay, so we've got a perfect foot. There you go.
No more troubles with your foot.
No more trouble. Well, yes. Fingers crossed. Not more trouble with the foot. Shall we see if she wants to try and saunter out?
I know you've probably got.
Let's see. The more she walks, the more she'll burn off that. And I said, oh, yeah, there you go. All right.
Okay.
Okay, Barbie, you okay? Let me help you up. There you go. So yeah, don't leave your mum. We've got the one old dog, now we've got the old timer. So that's Chopper off to her seemingly forever home with the gorgeous Barbara. So lovely to have an old dog that has, should we say, a more experienced person to be able to share stories and cuddle up together. It's a lovely ending, and hopefully the tumor won't regrow, and this dog with her now the 3 toes, and you call it 3 toes on the front, no one will comment about it. She'll be comfortable and she'll live as long a life as we can hope for.
I'm happy to report that Chopper has continued to recover wonderfully at home. She's back out on walks, pain-free, and doesn't even seem to notice her missing toe. And as yet, there still is no signs of mass regrowth. Chopper is truly a cherished member of this family, and for however long she has left, I'm just so grateful she's surrounded by love. This is what rescue is all about. For more remarkable rescue stories like Chopper's, please subscribe to the channel, and why not give this video a thumbs up to help me help more rescue animals here on Rescue Vet. Bye for now.